What's been your experience of working with and learning from non-medical staff in hospitals? For example, pharmacists, nurses, and phlebotomists.
So for me, coming into medicine, when I was applying, I was quite doctor-centric, and I hadn't necessarily considered how other roles are integrated into the healthcare system. And having the opportunity to speak to people such as physiotherapists and occupational therapists allowed me to sort of see how they interact in the healthcare system with doctors, especially in multidisciplinary team meetings. And for me, that helped create a sort of a really good idea of how the whole system works.
So I haven't had that much experience being taught by other healthcare professionals, as unfortunately most of our placements have been cancelled due to COVID-19. But last year we did get to go to a GP practice and to a hospital, and we did speak to other healthcare professionals there, such as nurses, nurse practitioners, practice managers, and I found it really helpful to learn from them and to get their perspective on things, because I feel as medical students we often hear things a lot from the doctor's point of view, but obviously doctors work as part of an MDT, so I thought it was really, really helpful to get an insight from other healthcare professionals as well.
My experience has been positive so far, and I always seem to learn more about the patients from the nurses and from the pharmacists as well.
The biggest thing that really struck me, even as a first year medical student, in shadowing and learning from doctors, nurses, all manner of healthcare staff, is that even though we're at the very, very beginning of our career path and our journey into medicine, we're still welcomed as a member of the team, as part of the medical family, if you like. We're not seen as being less because we're a student, but there's also not the expectation for us to know everything. Sure, you might have a doctor standing grilling you with questions, pushing you to learn, but they're always happy to help you and definitely appreciate if you're just honest and say, I don't know that yet.
My experience of learning from non-medical staff has been limited so far, but I'm really interested in getting to see how the multidisciplinary team works in action. All this combination of doctors, nurses, phlebotomists coming together for the treatment of the patient, all with the same goal in mind.
Working with non-medical staff has been really helpful. So they give you all kinds of tips and tricks to surviving in the wards, and you also learn about the practicalities of patient care, and that kind of influences how you would think about caring for a patient. For example, from the pharmacist's point of view, what kind of laxative you would give, how you would dose it, whether you would, and from the nurse's point of view, whether you would choose one laxative over the other based on the taste of the laxative, which would probably influence patient compliance, things like that.
So I think any medical student will tell you, when you go on placement, the non-medical staff like nurses, phlebotomists, healthcare assistants, they are your best friends when you're on placement. So they'll teach you how to do all of the smaller tasks like taking blood, cannulas, things like that, and they always have a lot of time for students, so make use of it.
So we're at the start of third year just now, which means that we've not really started placements properly yet. But in my student selected component last year, probably most of the teaching in that was actually done by nursing staff, got to speak to some pharmacists, etc. I think that speaking and engaging with sort of allied healthcare professionals, the kind of healthcare assistant staff, etc., can help provide a really important perspective on patient care that can be missed in the medical model sometimes. I think it's very valuable, and these are people that are very passionate about healthcare as well. It's their careers, it's their life. The only addendum to that I would say is that I think that medics tend to have more experience or expectation of teaching medical students, and so they tend to offer teaching opportunities a bit more kind of openly, whereas allied healthcare staff are not necessarily as expected to teach medical students, and so you kind of have to make those opportunities yourself. But if you do, that you can really glean quite a lot of wisdom from them.
And I think it's been excellent. With other staff, you really get to see that the medical profession is not like a solo thing. It is really about that multidisciplinary team, and everyone has that role in that team. It's kind of like a jigsaw, so it's not really complete without everyone doing their part. So it was really good. It also teaches you again the importance of communication. Everyone in the team has excellent communication skills, and they all have different takes and different roles, so it's good to get other people's perspective, and it's an excellent learning experience. So when you go to a hospital, I would really encourage you to speak to other members of the team, because you often learn so much more from them than the doctor maybe.